Good afternoon, everybody. My name is Jody Hanson. I'm Director of Public Affairs and Communication for Johnson County Government. Thanks for being with us today. Joining us today to give us a COVID-19 vaccination update, Dr. Sami Ariola, who's the Director of Johnson County Department of Health and Environment. We also have Elizabeth Holshoe, who is our Director of Epidemiology, and we have Nicole as our ASL interpreter. Thanks all of you for being here. Dr. Ariola, if you could start please by telling us how today's clinic went.
Thank you, Jody. Good afternoon, everyone. Our clinic went very well today. It was the last of the clinic that we organized that targets our residents that are 80 or older. And it was very well signed up for. It was very well attended. We continue to work in anyone that's 80 plus and as part of our 65 plus vaccinations that begins tomorrow. I will say before I go through the rest of the week that today we had an unusually high number of people that are younger than 65 who booked a lot of the appointments that were set for people that are 80 plus. Not only when you do that, are you taking appointments away from the people that they are intended to, it is very disruptive to our staff that are checking your ID and having to explain to you, and many of you taking time to not accept that the clinic is really not set up for those that are younger than 65. So we would again continue to ask for your patience. The clinics that we have, our criteria are based on the directives from KDHE. You have to be 65 or older to qualify for vaccines right now, unless, of course, you are in other categories as part of phase 2 tier 1. And we know that our teachers, K through 12 and childcare providers have been vaccinated through a different mechanism. We are, of course, vaccinating healthcare workers, but if you don't fit into those categories and we open up appointments and you take them up, we're probably not going to vaccinate you at the clinic. You are impacting the flow, but you are taking the appointments away from people who those clinics are meant for. Tomorrow's clinic is for 65 plus. And today we have received quite a few persons, 80 plus, that needs appointment, and we're constantly working them in. Thursday, we largely set that up for second dose Pfizer, but we're also working in additional first dose clinic for those that are 65 plus. And Friday, there are also additional opportunities for those that need Moderna vaccine, as well as second dose, as well as those that need Pfizer second dose. That's the rest of the week. Next week, the clinics that we have, earlier today, we opened up the initial 5,000 appointments for those that are 65 plus, and we would open up additional appointments to remaining on Friday to kind of fill the appointments. But we are tracking those numbers and we're watching the uptake. Again, it becomes very difficult for us if you are completing the online vaccine interest survey indicating that you're 65 plus and you are not. It makes it difficult for us if you are booking those appointments saying that you are 65 plus when you are not. It doesn't allow us to go through the age range and the categories that we're trying to vaccinate. And it makes our processes pretty difficult in our clinic. So we do continue to ask for your indulgence and ask for your cooperation. I know everyone wants the vaccine. We want to give you the vaccine. And this week, again, we did receive additional vaccines this week. This week we were notified that we'll receive maybe tomorrow, tomorrow or Thursday, an additional 3,700 doses of the Johnson & Johnson vaccine. Again, that's allowing us to vaccinate even more people. So we continue to ask for your cooperation.
Thank you so much, Dr. Ariola. Elizabeth, did you have some updates for us today?
I do, and in order to follow up with what Dr. Ariola said, I would also ask that individuals who are receiving our emails with the link to sign up for an appointment, don't forward those on. I think that's part of this, is that individuals are either forwarding on those links or posting them to social media. And this really does allow for other individuals to go on and make appointments and taking it away from people who really are at an increased risk for severe disease, who are at an increased risk for ending up in the hospital, who impact our hospital capacity. There is a reason and a method to this madness, or what appears to be madness, in terms of immunizing those 65 and up. And so we do ask that, if you do get an invite and maybe you're not 65 and up, maybe you put your birth date in there wrong, please don't book one of those appointments. Please don't forward on the link. And that will really help a whole lot. Again, in terms of our clinic flow, because every individual that we have to check the ID and have a conversation with them, it slows down the clinic for everybody else. So I know everybody's excited to get the vaccine, but I think that we all just need to remember why we're doing this and who is sort of slotted right now, and we will get through that. Every spot you take away from somebody in that age group means that we have to extend out our clinic because we aren't being able to fill those spots. So again, our plea to please be respectful of the order and the phases that we're in. But from my side of things that I work on, childcare and K through 12 vaccination continues. We have just started another childcare provider vaccine clinic about 10 minutes ago, where we will be hopefully immunizing about 1,200 childcare providers, mostly from our centers and a couple of our school age programs. And we're hoping next week to be able to get through the remainder of our childcare providers for first doses. Additionally, tomorrow, Thursday, we have K through 12 first doses as well through Children's Mercy. Again, an excellent partnership that we couldn't do this without them. And then this weekend, we start with some second doses, and then we do more first doses next week, and then we'll be on to second doses, we hope. So it's a very fast and furious schedule. We have multiple clinics set up a week, same as Johnson County does. And the staff, both our staff who run our clinics, but also Children's Mercy, who have physicians and nurses who are volunteering their time, on top of their shifts normally to come and immunize our teachers and our childcare providers. So that is moving forward and at a very quick pace. So we're very excited about that. The other really important update that we have for you today is for any healthcare workers or healthcare associated workers out there who maybe didn't get your chance to get the vaccine during our first round. Maybe you weren't able to, maybe you just weren't sure and now you've decided you want to, or maybe you've changed employment and now you're eligible as a healthcare associated worker. We have a brand new survey that's on our website. If you go to jocogov.org/healthcare then you can get to our survey and just fill out your information there. This is just a way for us to figure out how many people we have left. And as we have these clinics opening, to be able to invite you for those appointments. Again, really trying to have a very targeted approach for who's invited to our clinics to get through these groups as quickly as possible to be able to move on. So again, if you're a healthcare worker, jocogov.org/healthcare survey, or go to our Facebook page or our Twitter page, and you will be able to see it there.
Great. I know we've gotten some questions from healthcare workers, maybe that haven't gotten their vaccine yet, wanting to know what their action should be. So that's great news, great update for them. I was thinking when you were talking about vaccinating educators and childcare workers and what a great partner Children's Mercy is. I don't know if we've talked about that in a while as far as why they're doing it. So you might want to remind people watching today why Children's Mercy is doing this for us.
I would love to. I will say that Children's Mercy really from the beginning of this pandemic has been a really critical partner for us here at Johnson County, both in terms of us trying to open schools and looking at gating criteria and using their brilliant minds as a resource for how to do that safely. They have developed criteria for us and guidance as well. But now that we've moved into vaccines, they really wanted to participate. And the vaccines, only Pfizer is licensed for individuals 16 and up. Both Moderna and the new Johnson & Johnson are only 18 and up. So really, when we think about Children's Mercy and their clientele, the kids, they don't really have a role at this point in time in immunizing. But there are a number of individuals who take care of their patients, who take care of their clients, our educators, our childcare providers. And so Children's Mercy really wanting to be a good partner and contribute to the pandemic response and to further what they'd already been doing, really stepped up and said, you know what, let us take care of the people who take care of our patients. And it's been a tremendous, tremendous partnership. Dr. Jennifer Watts, who is their Director of Emergency Preparedness and an emergency room physician, has really been leading this. And to tell you, it is a very impressive set up the same way as our clinics are, usually about 20 vaccinators. We get through 1,200 in about 4 or 5 hours. So really on pace with what Johnson County can do. And it's just really incredible. And so we're so thankful for their leadership and their partnership. And it means that Johnson County Department of Health and Environment is able to focus on the community at large while still getting this very important group immunized. So again, just a huge thank you to Children's Mercy for the partnership in this.
And I do want to echo that. Really, even before vaccination, like Elizabeth was saying, throughout the response about keeping our schools open, about keeping our children safe, a really big shout out to Children's Mercy for being a team player, for their really commendable commitment to health in the community. I do want to reiterate what Elizabeth said. They have been a great partner throughout this process.
And really, all of our healthcare systems are partnering with us on this effort. Are there any updates either this week or looking ahead to next week? Are those healthcare systems getting doses, and are they holding clinics for either the public or their own patients?
Yes, they all are, and I was talking to several of them yesterday, and some of them this morning, and they are continuing to vaccinate in the 65 plus group. And it's not for them. It's really not capacity. It's really that we currently don't have enough vaccines for them. I mean, yesterday I was on the phone with one of them that could use 3-4 times, maybe 5 times what we're able to give them. So that's ongoing. We have more vaccine coming into the county. Like I said, it gives us more opportunity to vaccinate people. We've got all of our appointments next week, vaccinating 65 plus, and they are vaccinating in that group. And when we look at our numbers, that's why it's important that people cooperate with us, because our decisions are driven by our numbers. So if there are people that are completing those numbers with the wrong information, whether we think most of it are not deliberate. So I do want to emphasize that, but it does throw kinks into our assumptions and what we're trying to do. But we feel like in the next couple of weeks, with a very strong focus on 65 plus, that we are beginning to make a dent in the number of persons that remain in that group. I do want to add a few more information. Beginning this week, in our clinic this week, those that are 80 plus that have indicated to us that they need help with transit, because of our cooperation with our transit group, we're going to begin to transport about 20 of them to our clinic beginning tomorrow, really, to be vaccinated. So that's a huge plus. We've been working on that for a while. They qualify for the vaccine. They need help. That again exemplifies the level of cooperation that we have, but that is needed to push this through. So that's good news. We are finalizing details about taking vaccines to those that we need to go and vaccinate where they are, and we think that should be ready in the next 1 week. So we're making progress and trying to address all of those details. We have a team that's working with UCS and working with other partners that are addressing even further issues of equity. We have teams that are looking into how we are going to vaccinate our homeless population. And so just really letting people know that a lot of those things are being addressed. And as we get more vaccine, and I did mention yesterday, our focus on our developmental services. And so, so a lot of the decisions that we make in terms of what we do with the vaccine is based on this vulnerable population and priority population. So it may look like it's just they're random decisions, but they're not. We did talk about our priorities over the past 1 year, 1 year being our vulnerable population, our elderly. That's why they're the primary focus of our initial rollout. We did talk about what has been our primary goal of keeping our schools open, our teachers safe. That's part of our decision to include them in the tier 1 of phase 2. So and if you look at our numbers, you're seeing the impact. Now we haven't vaccinated enough people to give too much credit to that, but a lot of those. And every time that I see that some long-term care facilities are allowing loved ones to see their moms and dads and granddads, Every time that we are talking about being able to have our schools open in person, we do know there are level of risk associated. I don't want to minimize that, but those are really consequences of the targeted database decisions that we're using to make decisions about who to vaccinate.
Great. Thank you both for sharing those updates. I'm going to go ahead and take some Facebook questions. Someone has asked, do you need to currently be 65? Or if you're turning 65 sometime this year, are you in this tier?
So this tier is 65 plus.
You have to actually
So
be 65.
you have to be 65, yes.
Not turning 65.
Now some people are turning 65 today, tomorrow, or whenever you turn 65, you do qualify, yes.
Okay. Somebody wants to know, will you be offering the Moderna vaccine? This person is over 65 and needs the second dose on March 13th. So where are we, I guess, on Moderna for second doses?
Yeah, so if you are due your Moderna March 13th, then you must have received your first dose from somewhere else. So the first step you need to do is go to where you got your first dose. I received an email yesterday from somebody also saying their second dose is due 2nd of March. They got their first dose from one of the local pharmacy group. So you should assume, and they should tell you that your second dose will be available where you got your first dose from. That's what you should do. So you shouldn't be looking around for the second dose. You should go to where you got your first dose. They will give you your second dose. The second dose is automatically shipped to the same location. Now, if you absolutely cannot get it, then reach back to us and we'll figure out how to. We have some people that got their dose from out of state or for different reasons or another. Again, we are only sent enough second dose to cover the first dose that we get. So again, we can't accommodate too many of that. We can do our best to assist, but you should go to where you got your first dose from.
Great. We have a question. Somebody is looking for a little more clarity on what the definition of a personal caregiver would be. This person says that her mother is 90 and lives in an assisted living residence. She takes her to her medical appointments outside the residence about once a month. So would she be considered a personal caregiver, and when would she be eligible for a vaccine?
Our mom lives in an assisted living place, so I'm sure that I assume that our mom, as well as the workers where she lives, have been vaccinated. So in this case, you're just going to have to be patient and qualify based on your age, or if you qualify through other categories. It's hard to classify you because you take your mom once a month to the hospital as a caregiver. Now, having said all that, I am hopeful that we're very close to where it really doesn't matter. These categories do not matter. When we get to a place where you want the vaccine, we're able to give it to you. The only reason why all of these are there is truly because we don't have enough vaccine. And I am praying that we get to that level very quickly. You want the vaccine, we want to vaccinate you. The only reason why we have to put this limit is we just don't have enough, and we're trying to target this towards a more vulnerable population. I would say if you're picking up your mom, wear a mask and take all of the necessary steps.
Great, thank you.
Check your car window too, if you're riding in the car while you're both masked. The ventilation is also really helpful. So something I do with my mother-in-law who's 81.
Yeah, and the weather is friendlier now that allows it's getting warmer. So ventilation is our friend. That's something to keep in mind. Yeah.
So having windows open in your cars or maybe even your homes, if it's comfortable enough for you, is something that we're working towards as the weather gets warmer.
Yes.
So somebody that is 65 plus who has taken the interest survey and has not heard from you yet, is there a ballpark of is it the next 2 weeks? Is it the next 4 weeks? Is there any kind of a time frame that people can expect if they haven't heard yet? Eventually they will hear in that time frame.
I'll let Elizabeth take that.
Give me the hard question. Thanks, Dr. Ariola. So I think honestly, we'll have a better idea after this week how this is going to sort of phase out. And the reason I say that is that we know that our healthcare systems and our pharmacies have been immunizing people over the age of 65. And so if you take the entire pool of people who have filled out our interest survey, we have to expect that at least a proportion of those individuals have gotten it somewhere else. And so the way that we do this is when we open up appointments, so say we open up 5,000 appointments, we'll usually send out invites to 6,000 people and we'll see how quickly they fill up. And if we still have open appointments, then we'll take another chunk of people. And once we start doing we'll be able to get a slightly better idea of the percentage of people who maybe have been able to receive it somewhere else. And so while I don't have an exact answer for you right now, certainly the increase in vaccine that's coming to our community, the fact that we're going to get some more doses to our healthcare systems, the fact that our pharmacies are getting them, I agree with Dr. Ariola that we will be able to move through this 65 plus much quicker than we would have been able to, even 3 or 4 weeks ago. So stay tuned. We'll be trying to figure out exactly what this looks like as we move forward. And we should start getting a better idea for that.
And we have, go ahead. I'm sorry.
I was going to say you'll be able to help us out again if when we open those appointments, you leave them to those that are 65 plus. It throws up our data. It throws up our flow in the clinic. When we have an appointment, when we make appointment for 1,400 people, and less than 1,200 of those are actually people that qualify for that. So it throws up, and we are staffing these clinics based on the flow and the number of people that needs to be vaccinated. Obviously, if you don't qualify, we will not vaccinate you until it gets to your turn. Not only are we losing what we have calculated for and not able to maximize that, staff are spending literally hours explaining to several of you what you already know. So we're asking that if you're not 65, please don't show up.
And it really has to be the honor system, right? Because the system won't kick you out. I mean, there's really no way to know until you show up and you don't have the proper identification. Yeah. And then you've wasted a trip. So it's also, it's wasting a little bit of your time as well.
Yeah, that is correct. The appointment booking system there's no way for it to check your ID or anything, but our staff will when you get to the location. So it's really we're asking that you help us so that we can answer those kinds of questions. If our data, if we know that we can make better inferences from the data, then we can project forward a little bit. Of course, still depends on how many vaccines that we're getting, but Elizabeth rightly described that. We'll see what happens with the appointments that we open up next week. And we'll prepare to probably do something close or similar the following week to see whether we see what the uptake numbers are for the 65 plus, and we'll be making a decision after that on the other groups. Now, once this is the largest group, once we almost through this group, the rest in phase 2, with the level of vaccine that we are currently receiving, hopefully we get more. It'll be quicker to walk through those groups. So this is the main group that we have to walk through. Yeah.
And we have a question. So Elizabeth, earlier you were talking about, you're going to be opening up 5,000 slots next week. You send an email to 6,000 people who have taken your interest survey. How do you pick those 6,000? Is it random? There's a question there. How are those people selected when it's their turn to make an appointment?
Absolutely. So we take the individuals who responded to the survey first, and we take that list. So in the order that people responded to the survey, we just take the top 6,000 and we send that list. And depending on how many appointments we have open, say we decide we need to send it to another 1,000 people, we'll take the next 1,000 people and send it to them. Again, if you have already filled out the survey, please only fill it out once. I think we have somebody who's filled it out over 100 times. Only one time is necessary. So we will get to you. I know it's taking longer than any of us would really hope for, but unfortunately, it's a consequence of how many vaccines we're getting into Johnson County. But hopefully we'll start moving through this group now that we're able to open it up, now that we're able to move beyond our childcare and our educators here in the next few weeks. So stay patient. I know we've asked you a lot of that of you to be patient, but hopefully we'll be moving through soon.
We have a question. Once you get both of the doses, whether it's Pfizer or Moderna, how long will you be protected?
So obviously the recommendation is you get full protection 2 weeks after the second dose. So keep that in mind. So there's no definitive answer yet. What we think right now, based on available data, is at least you get protection for up to a year. It is possible to be slightly more than that, but it's also possible that we need booster shots in the future. Those are things that we need data to more clearly answer in the future.
Yeah, and I'll say that currently, because of that data, so if we think about this, we really only found out about SARS-CoV-2, the virus that causes COVID-19, about a year ago. And we now have vaccines that have been created, which is really an incredible feat, given the science and the fact that it's a novel virus. But we just don't have the data long-term to tell us how long that immunity from your vaccine lasts. So at this time, CDC is saying that if you're exposed within 90 days of your second dose, that's how long we know for sure that immunity lasts. It's probably longer, like Dr. Ariola said, it's probably a year or so. But for now, with the existing data, CDC says that if you're within 90 days of that second dose and you've been exposed and you remain symptom-free and you're at least 2 weeks full immunity, then you don't have to quarantine. And so that will probably change, but I do want to let you know that 90 days is sort of floating out there from CDC.
And I think that's an important distinction to make as we make decisions on who needs to be in quarantine and who doesn't. So because some people have asked the question, will I have to be in quarantine if I am exposed? And that's why I think the 3-month distinction is an important one. So beyond the 3 months, you might be asked to quarantine, but there are clearly data that's showing that your immunity will last longer than that.
Well, thanks to both of you. Great information today. It looks like we're getting close to our time, and I see there are a few more questions. So as always, our team will be on there answering questions either today or into tomorrow morning if there's anything we didn't cover here today. Thank you so much, Dr. Ariola and Elizabeth. Thank you to Nicole. Great information today. And thanks to all those watching on Facebook who are asking us questions and interested in this topic. And we will be back with more information tomorrow. Thanks so much and enjoy the rest of your day.